Yeah, just a quick review of the JIUFENTIAN copper knee brace. So this brace is designed specifically for people that have knee pain or having knee problems. I probably wouldn't really call it a brace. I would actually call it more of a sleeve because it's braces usually have like metal things on the side, or they have some kind of rigid components to it, which this one does not. Nonetheless, the idea here is that you put on the brace or the sleeve, and it will support your joint and the surrounding soft tissues. So that way your knee has a kind of a chance to rest, recover, and it doesn't get stressed so much as you're doing different things. So a few points about this particular brace. It is made of 60% copper nylon. So nylon is a very durable material, so I expect that this sleeve is actually going to last you a long time because the fibers are just so resilient and they're strong. The other thing is, a lot of times the problems with these knee sleeves is that they keep falling down. They've actually gone to great lengths to put these silicone anti-slip strips here. So this is like silicone. It feels kind of sticky if you touch it, and so that made to actually ensure that sleeve is going to stay up. So yeah, you have knee problems, definitely bracing it is going to make it feel better. There are other things you can do for your knee. As an example, getting this from Bulletproof Your Knee, you want to make sure that you strengthen your quadriceps muscle. You'll be doing some kind of exercise to keep them strong and get them stronger. The reason being is and this whole chapter is dedicated to different knee problems, and the research that shows if you have this problem, you probably have a problem with your quadriceps muscle. So for instance, if you have like knee swelling, there's actually studies where they show that if you have swelling in your knee, or actually if researchers like inject, you take a normal knee and you inject it with so many milliliters, you're not going to be able to lift your leg off the table if you're laying down. There's actually studies showing that because it kind of inhibits the quads. So if you have knee swelling, it definitely affect your quadriceps muscle. Now your quadriceps is that big muscle on the top of your leg. Knee injuries in the quadriceps, finding like people that have fractured tibias, surgical removal of part of the knee, or they've opened the joint out surgically, could have problems with your quadriceps. ACL, anterior cruciate ligament, all sorts of ligament problems. So in other words, this is a study that showed, they took people with that tore their PCL or posterior cruciate ligament, and they showed that, hey, you had a decrease in quad strength. And it's funny though, because it's not really a lot of the other muscles that are affected, it's kind of selectively your quads that become weak. And also some of these studies are showing the quad is either weak or it's smaller than normal if they look at like cross-sectional CT scans. Medial collateral ligament tears, just having knee pain is enough. People have a lot of knee pain, their quads aren't as strong. Knee arthritis is a biggie. A lot of studies showing that if you have knee arthritis, you have weak quads, and also if you strengthen your quadriceps muscle, your arthritis pain gets a lot better. And actually, there's actually some studies showing that the stronger your quads are, and the more you strengthen them, you actually slow the progression of your knee arthritis. So lots of cool stuff. Patellofemoral pain syndrome. People have weak quadriceps. Kind of interesting. So definitely want to be looking at that. Other thing, fine-tune control over your knee. The other thing you can think about doing, a lot of times knee problems are because you have a problem up at the hip. And then I'm talking about things like your hip abductors is the big one. Those are muscles that kind of make your leg go out. Big example is iliotibial band syndrome. If you have that, they've taken a lot of studies actually out on that where they've shown that people that have iliotibial band syndrome have weak hip abductors. So likewise, there's also some randomized controlled trials showing that if you take people with iliotibial band syndrome, you strengthen their hip abductors, that their iliotibial band syndrome goes away. So definitely not to be overlooked. Knee flexibility, definitely keep your knee flexible, you're stretching it. A lot of people think the knee just goes up and down, it bends and straightens. As this little test actually showed, I thought it was kind of nifty, about the last 15 degrees of you straightening your leg, your knee actually rotates. So it's kind of an accessory motion you have with your knee. You'll definitely want to get that back to get full knee function. And then lastly, what you can consider doing, increasing dynamic knee stability. Here they're talking about proprioception. Proprioception is your position sense. So let's say, if I turn the lights out all of a sudden, you could tell me whether your knee was bent or straight. And that's because your proprioceptors, these are the joint receptors and the receptors in the muscles that, tell your brain, where your knee is in space. And they're finding that when people have knee problems, their proprioceptions decrease. There's actually exercise you can do to fix that. But anyway, other stuff you can do. But hey, nothing's as quick as slapping on a knee sleeve or a brace gives you that kind of instant, pain relief. So yeah, it's a good brace. Check it out.